How's your arm been doing?
I went to the ER a couple of weeks ago, and they said that they treated me, but it hasn't gotten any better.
What's up with your healthcare plan?
Sadly, I didn't have health insurance because I canceled my plan a while ago. As bad as the plan was, I really wish I had coverage right now. The hospital treated me, but if I want more treatment, I have to pay out of my pocket.
$50. In many cases, you can get health insurance for less than $100 a month. Just go to healthcare.gov to figure out how to sign up. February 15th.
Long ago, the sole function of hospitals was for them to function as a place for the impoverished to find their final resting place. It was only until the progression of modern medicine began to come into play that a wholly new function was set about. Even so, hospitals were still using archaic methods and ineffective remedies. In 1900, the average American spent $5 a year on healthcare, which is only about $100 in today's currency. As medicine began to advance, so did its effectiveness, thus resulting in higher prices from the better research and technology. Around this time, the US was being ravaged by the Great Depression and looked to stem the issue. Baylor University Hospital developed a plan that is similar to the one we use today. An attendant at the hospital noticed, "We spend $1 or so at a time for cosmetics and do not notice the high cost. The ribbon counter clerk can pay 50 cents, 75 cents, or $1 a month, yet it would take about 20 years to set aside enough money for a large hospital bill." Today, the healthcare system has made giant leaps compared to its rocky past. Through the Covered California system, various coverage plans are available. If you're under 30, then you can receive a minimum coverage plan which will only protect you from worst case scenarios. Next is Bronze, where your plan pays 60% and you pay 40%. Silver pays 70% and you pay 30%. Gold plan, it pays 80% and you pay 20%. And lastly, the Platinum pays 90% and you pay 10%. The Affordable Care Act, also known as Obamacare, was also recently passed. This act gives many new rights to those looking for affordable healthcare and makes it so every citizen has healthcare, as seen in the interview with Sally Coker of Gold Coast Insurance.
For two reasons. First, the Affordable Care Act got rid of pre-existing condition limitations. So before that legislation, if you wanted to buy health insurance and you had anything in your history, like for example, if you had cancer and you said, okay, I want to buy health insurance, the insurance company was able to decline you because you had a previous health issue. So with the Affordable Care Act, that was eliminated. So now regardless of your health history, the insurance companies must insure you.
But even so, many questions are raised about the cost of American healthcare in accordance with its quality.
Well, I think there are a lot of drivers. There's the aging of our population, there's technological innovation and explosion. But I think the biggest single driver is our fee-for-service system that rewards volume instead of value and quantity of medical services instead of quality. And as a result, we end up doing a lot of things that cause more harm than benefit for patients.
Currently curing a disease takes precedence over preventing its occurrence. As the implementation of digitalization in healthcare soars, access to medical records will be much more accessible. This will also cause a shift from general healthcare to personal healthcare. Personal healthcare will assist greatly in increasing the quality of treatment.